You are welcome to the Reproductive Health segment with Dr. Ajayi. My name is Dr. Abayomi Ajayi. Last week we started male factor infertility and we took you to the laboratory. We showed you the latest thing in the treatment of male factor infertility, which is the IMSI, or like Paul told us, it's intracytoplasmic morphologically selected sperm injection. But today we're continuing on our male factor infertility. But before I do that, I need to recognize all the mails that I've received and the text messages. I'm going to dedicate one of these programs to answering some of the questions that you have raised. But today we are still continuing on male factor infertility. And I'll try to define male factor infertility as the inability of a man, just simply put, to make a woman pregnant. Okay? Now, for a man to be able to make a woman pregnant, he needs to be able to produce and store sperm. He needs to transport the sperm outside his own body to the reproductive tract of a woman, simply put. Now, this male factor infertility is the singular most important cause of infertility all over the world now. The bad part of it is that there is very little awareness, not only in Nigeria. I was reading a study a few days ago in the UK where about 1,000 men were interviewed, and about 59% of them said their wife is likely to have fertility problems more than they can do. Still emphasizing this fact that people still think that fertility or infertility is a woman's problem, not only in Nigeria. So in Nigeria it's even worse. I'm sure if we did that kind of study, it might be 80%. Now, there was a study that just came from Denmark a few weeks ago that showed that about 1 out of every 5 men, 1 out of every 5 between the age of 18 and 35, had deranged sperm count. So, and we are seeing that even in the last 30 years, there is documented evidence to show that sperm count is decreasing. But the awareness is just not as much as it is. And people are now looking at, instead of, you know, a few years ago, we were talking about that most of these factors were people were born with them. But now it's shown that lifestyle factors are the most important things. Things like smoking, alcohol. We're going to dedicate one of the next weeks on this discussion of lifestyle factors. But this includes smoking, alcohol, stress, drugs, people who use bodybuilding drugs, some people who use antibiotics that they're not prescribed. People who do some kind of work. Horticulture is becoming common now. If you are exposed to fertilizers, you know, or pesticides, DDT, pesticides that contain DDT, that might affect sperm count. And of course, we can't rule out things like injuries to the testes and of course, sexually transmitted diseases. Other factors that we need to consider is the age of the man. People think that it's only women who reach menopause. I'm sorry to disappoint you, but we can see now that the semen analysis of men older than 40s shows derangement more than the people who are younger. So we know that age is also important, not as important as in women, but it's also important in men. And of course, medical conditions like diabetes mellitus. Unfortunately, the only way to diagnose male factor infertility is by doing a semen analysis. You know, so you can't look at sperm from your just visual observation and tell whether sperm is good or is not good. Other things that can be done is sometimes we do testicular ultrasound to see, especially one thing that we always try to emphasize that once sperm count is low, I'm talking about sperm count below 5 million, very low, severely low, you must do a testicular ultrasound. Because that is been shown that sometimes that is the way that the testis is crying out for help. And you need to look and see that there is no tumors in that testis. So other things, you could do a rectal ultrasound to see whether the prostate gland is enlarged. Now, we just spend the next few minutes on treatment. And we talk about drugs, we talk about surgery, and we talk about ART. For drugs, some drugs, there are no sperm boosters. Take that home. But other things like people using antioxidants, Proxid is one common thing that people use now, might improve function, but definitely will not improve the quality, the quantity. Might improve function, but not quality. So things like surgery, varicocelectomy, well, I'm not against varicocelectomy, but when you do varicocelectomy within 1 year and it does not give you the desired result, then you need to do other treatments. And that brings us to assisted reproduction, in which is the main treatment for male factor infertility. You can take it for people who have very moderate oligospermia, that's what we call low sperm count, who have moderate oligospermia, or you can use intrauterine insemination. But the main thing is either you are doing intracytoplasmic sperm injection, ICSI, or you are doing IMSI, if the sperm count is really very bad. And like Paul showed us last week from how he does his IMSI. IMSI, once the sperm count actually is less than, he gave us the parameters, 5 million, less than 5 million, motility less than 20%, you are a candidate for IMSI. That gives the very best results when it comes to male factor infertility. Unfortunately, IMSI is very new all over the world, and very few centers still have it. Fortunately, it's available in Nigeria. So male factor infertility is something that the first thing is the awareness. We need to know that it exists so that we can get the right treatment for it. And that's the note on which I'm going to leave you this week. And next week, expect we're going to have a guest in the studio who is going to continue this discussion about male factor infertility. So see you next week then.